Hi, I'm Dr. Keshishian, and welcome to our podcast series, PPE, Podcast for Psychoeducation during the COVID-19 pandemic. Today, we're discussing how the pandemic has affected members of the LGBTQ community. Since June was Pride Month, it is a pertinent time to talk about these issues. As the pandemic has forced us to reinvent the way we practice medicine, individuals may have experienced postponement in gender-affirming procedures, complications in receiving hormones, difficulty discussing sensitive issues with their providers via telehealth, and added struggles of isolation, potentially limiting social support. I am joined by Dr. Tracey Samko, the Associate Program Director for Combined Internal Medicine and Pediatrics, and Mr. Hudson Tibbetts, a registered nurse and chair of the LGBTQ committee at LAC USC Medical Center. Hello to you both.
Hi.
Hello.
Thank you for joining us. Today, we're discussing some common emotional responses transgender patients can feel regarding changes in their medical care, specific challenges telemedicine and distance care brings to the LGBTQ patient when discussing sensitive issues, and hopefully come up with some strategies and coping mechanisms together. So, Dr. Samko, could you discuss some of the changes in the medical care that you have observed?
Sure. So I am the combined APD for MedPeds, but I also, most of my clinical work is done in the Adolescent Care and Transition Clinic and the Alexis Project, which is our LGBTQ arm of service. So we do a lot of primary care as well as consulting care for members of the LGBT community of all ages. So we're seeing kids all the way through geriatrics. So really the full spectrum. And I think one of the most difficult things about transitioning to telehealth for everybody, not just for LGBTQ patients, is the lack of personal connection. Like when you're sitting in the room with someone, you can really make a connection that I think just often lacks over the phone, especially when you're discussing really what some consider sensitive or difficult topics that if you are a person who identifies as LGBTQ, the LGBT community has experienced a lot of discrimination in the healthcare system, and many people do not feel comfortable disclosing their identity to their healthcare provider. And I find that when you're sitting in a room with someone and you can convey with either your facial expressions or your body language or just the words that you're using, that you are, or even like the posters that you have on the office wall or some of the signage that you might have at entryway, that you ask a person to write down the name that they use and the pronouns that they use at the sign-in desk. Like those things set the scene that you're going to be an open and affirming practitioner. And when you're doing a telehealth visit with someone, they're missing all of those visual cues that signal that you are someone who's an affirming provider. So you're basically asking, when you're establishing care for somebody new, them to really trust you without ever having laid eyes on you, seen you, know who you are and what you're about. So we have, some advantage by with the Alexis Project, like already that many people know that they're coming there to get that affirming care. So they're assuming they're going to be seeing an affirming provider. But I think in general, primary care is extra difficult for LGBTQ communities at this time. We're also seeing, unfortunately, a lot of postponement in medically necessary care, particularly for our trans patients who have been oftentimes awaiting gender affirming surgeries oftentimes for months to years already, when they have been in other systems, maybe with other doctors who didn't know how to get them engaged in the kind of care that they needed. So they've often been waiting a really long time for these procedures. And I have several patients who were finally scheduled and they were so excited. And then this pandemic hit and now their procedures have been postponed sort of indefinitely, which has been very, very difficult and challenging and is not without its own set of morbidity from mental health, not getting the procedure that you need. It's medically necessary. It's not considered elective. So that's been a real challenge and struggle.
Thank you for explaining that so clearly. I think you make a lot of really good points, that there's not only the body language, but the visual cues and the reception at the front and the materials that you're given that opens up and sets the tone, like you were saying, for your session with your provider, and you're missing out on all of that with the telemedicine. And especially if you're establishing care for the first time, it can be very difficult to put your trust in somebody that you're not seeing face to face.
Yeah, I think it's yeah, I think it's really challenging. We're asking a lot of patients who have already asked a lot of for them to put our trust in us in this time, and then we're telling them, "Thanks so much for telling us all that stuff. We can't do anything for you right now. You're going to have to wait," which I think is also, it makes it challenging to build therapeutic relationships.
Patients might be feeling frustrated, sad, helpless.
Yeah. And I think a lot of trans patients specifically who have been so stigmatized and marginalized by the medical community, who have experienced so much gatekeeping and providers saying, well, I can't give you that service now. You're going to have to wait. You need to jump through XYZ group, you need XYZ letter, to then finally reach a point where you're about to get the thing that you need. And now you're being told, oh, well, there's a pandemic. So like there's other people who are more important than you. You can't have this thing that you need anymore. So I think that's also been really challenging.
Right. Who defines the importance and kind of
Right.
where does that fall into what you
Right.
need as a person?
Right.
Absolutely. Mr. Tibbetts, what do you think about how the LGBTQ patients and patients in general are feeling?
Let me touch on the trans patients first of all, and the trans friends that I have. There's a lot of despair going around now. Not only are there the concrete barriers from COVID, but about 2 weeks ago with this HHS ruling on trans protections for healthcare being removed or absolved by the current administration in Washington, I see a lot of despair with my trans friends. So this is not only another concrete barrier, a high potential for one, but it's a continuation of the insidious discrimination that they feel, that they're unwanted, that they don't belong as participants in mainstream culture, that there is an entity out there that is constantly and actively working against them. It's very hard to have a healthy, well-adjusted life when you know that that's a reality. Overall, LGBTQ people, patients, and my friends, I see a lot of insidious, low-level, chronic depression. As LGBTQ people, we are more socially dependent on each other since a lot of us do not have those families that are supportive, peers that are supportive, communities, etc. So we're much more dependent on each other for affirmation and for just daily well-being. I know a lot of people that I have reached out to just to see how they're doing have not responded over the last few months. And when in those cases, when I do get feedback, it's often because, oh, Hudson, I've been just feeling so depressed. I got your messages, but I didn't return your calls. I'm sorry. I've just been feeling so down. I don't have the energy to engage with anybody. That's what I'm hearing from people. And the counter side to that is, instead of engaging with other people, which is so essential, we have social media and the internet, which are so mesmerizing and I'll call it stupefying. Those are tools that are used as maladaptive coping. And I'm kind of guilty of that too with the internet and YouTube. But I am reaching out to people. I think that's such an easy distraction to pull you away when you're in a depression or in a despair from dealing with your issue, which is really the solution, and the medicine there is talking to other people, actually connecting in a human way.
No, I think you made a really good point. In general, humans need human interaction. And during this time where we're asked to isolate from one another for safety reasons, it is extremely challenging. But I think you even touched on something further, which is in the LGBTQ community, the reliance on these social networks that you make for yourself, that you find comforting and safe and supportive for you. If that's not there, then it feels like an even greater loss. Any suggestions on what you've told your friends or members?
I've found that because of my clinical experience and my very limited knowledge as far as what is cathartic, what is therapeutic, um, I put the onus on myself to reach out. And I'll make the calls, I'll send the emails, I'll send the texts. And if I don't get a response, I'll keep it up. I'll let some time pass, but I don't just say, okay, they're not responding, move on. I don't give up like that because I know what it's like to feel stuck. So my solution is um, persevere. Persevere in your attempts to communicate and reach out. Because quite often it won't be the other person that does that. It will be the clinician.
Right. And Dr. Samko, it's you work a lot with the transitional age population, and with the schools being closed, a concern is potentially if an LGBTQ youth does not have a supportive home environment, that their social supports or the school supports might be their avenue of where they normally feel comfortable. What have kind of you talked to your patients about? What have you seen?
Yeah, that's such a great point. I fear that we're actually missing the patients who we should be seeing because of those reasons. So many times, especially when a youth doesn't feel comfortable with their sexuality or their gender or who they are, and their real community is at school and that's the place that they can be themselves. My fear is that because they're not able to live as their authentic selves at home, and now that's the only place that they can be, that we're not seeing those youth, and it's a missed opportunity. And there's a lot of concern right now in the foster care and the child abuse pediatric groups that we're missing a lot of child abuse, not just of the LGBTQ youth, but I certainly worry about LGBTQ youth in that setting because we know they're at higher risk for abuse, and especially for depression and also for suicide, especially when they can't live as themselves and have no social outlet. So I am really concerned. Like the patients who I already see who are already connected with me, I'm way less worried about them. Like I know that they have people following up. I know that they have connections. I know they have a social outlet. I'm way more worried about those kids who we don't know about, who we don't see, who haven't found a way to reach out and become part of the community yet. And we're using school as their main coping mechanism. And now that that's gone, I mean, I think a lot of kids, regardless of their gender identity and sexual orientation, are really struggling right now because social connections are so important and they're missing it. But I especially worry about our LGBTQ youth. But just to touch on one of Hudson's points, I do think for a long time, I mean, this is not new, but I think in the LGBT community, especially in more rural communities, the internet and social connections, like social networking, has been a main way that many youth have found their community and found people who are like them and known that they're not alone, that there are other people like me out there. Like the internet has been huge in people realizing who they are and connecting with those people. So in that way, I think, like having access to social media and having the internet and like having those outlets and being able to find people and connect through groups like that is still hugely beneficial. And so a lot of our kids have cell phones. A lot of our kids can connect to the internet on their own, can know how to hide their browsing history from their parents, which in cases like this, I think is good and important. Like, hopefully they're able to connect with the people that they want to connect with because they are savvy on the internet. And so that hopefully they're able to find ways to not feel so alone. But yeah, I've been really, really worried about kids who are not connected with us. It's been really heavy on my heart during this last Pride Month. I've been thinking a lot about them.
I think that both of you had made a lot of very good points. The first takeaway, I think, is the fact that if you are connected with a healthcare provider, to make sure that you're vocalizing how you're doing, because your healthcare provider is there. We have to look at you holistically, not only just your physical concerns, but how you're doing mentally as well. And if you have an appointment, even if it's a telephone visit, please make sure to vocalize how you're doing so that we can get you the right resources and make sure that we are providing all of your needs. So I think that's a good place to start. But I think the other good point that you made was that there are other ways of connecting right now, even though it's not what we're normally used to, that there are avenues to connect with other people, and that might be just as important. So making the effort to do that is another good way to go. But then also the third that you touched upon is the people that aren't connected in any sort of way. And it's really our responsibility as a community to look out for one another. So if you see somebody that's struggling, or you're worried about somebody that might not be doing well, is to take that extra step and try to reach out to them, so that we make sure that we take care of one another during this time.
And I think, this has been an extra introspective and an extra hard Pride in many ways, like an extra hard Pride month. I think everything that's going on with our confrontation of systemic racism within the LGBTQ community, and really taking stock of how we as a community have maybe not been as in strong support of the Black Lives Matter movement and the movement for equality for Black people in addition to LGBTQ people, like seeing how those two movements really go hand in hand, and recognizing that Pride was initially a celebration of a true riot that was started by Black and Brown women of color. I think this has been a real introspective time for the LGBTQ community. And I know I myself, as a member of that community, have been doing a lot of self-searching, not just in my personal practice, but in my personal life. Like, how can we be better? How can we move forward? How can we be better partners for everybody in our community, so that we can all do better for each other and all take better care of each other?
Thank you for saying that. Mr. Tibbetts, any final thoughts?
I will agree that this has been a very unique and difficult Pride Month, because we're so dependent on each other for affirmation. But then I have seen people find very clever and ingenious ways of connecting with other LGBTQ people despite adversity. It seems like we have a knack for making our connections. We've always been under this subliminal duress. So we know how important we are to each other, and we find ways of making that happen.
Hudson had touched on the HHS directive, the 1557 order. I just wanted to make it really clear that that's not applying to California, that California has its own state laws in place for protections for healthcare for LGBTQ individuals. So while nationally it is very upsetting, like to directly affecting our patients, we don't expect it to have any effect, because luckily we live in California, which is a really supportive state. So that has given me some solace. And the Supreme Court case, I think, was really unexpected, and really just a great celebration of Pride, that, we're now recognizing gender identity and sexual orientation as part of protected class in terms of employment. And I think we're going to see that being applied to not just employment moving forward. So I am hopeful that that rule won't be able to stand nationally as well, in light of that Supreme Court ruling. So I just wanted to mention that.
Thank you for that clarification. Really appreciate the work you both do.
Thank you for having us.